I'm Senator Megan Hunt, M-E-G-A-N-H-U-N-T, and I represent District 8, which is the northern part of Midtown Omaha. I'm here to present LB716. This is a bill that would expand the list of qualified medical professionals who can perform abortions in Nebraska. Previous Nebraska legislatures have created layers of medically unnecessary restrictions on access to abortion care, making it harder than it needs to be for people who need an abortion to receive one. One of these barriers is that Nebraska is a physician-only state, which means that our current statute prevents anybody who is not an MD from performing an abortion. Abortion is well studied and safe. Many duties that are currently performed by MDs can also be done by our skills licensed advanced practice registered nurses, certified nurse midwives, and physician's assistants who have extensive medical training and are subject to rigorous training standards. In fact, in a third of states, nurse practitioners, midwives, and physician's assistants are safely and effectively providing abortion care today. Studies show that abortions are just as safe when performed by trained nurse practitioners, physician assistants, and certified nurse midwives as when they are performed by MDs. In one 6-year study published in the American Journal of Public Health, which is a real journal, it's not like, sometimes in these committees, someone will pass out like a journal article and I give it a little Google and it's like, okay, this was published one time in Bulgaria and it was funded by the Tobacco Association. You know, it's always something crazy, but in one very legitimate peer-reviewed 6-year study, the complication rate was low and it did not differ between physicians and these non-physician advanced practice providers. So even in states where they have APRNs and certified nurse midwives and physician assistants performing abortion care, there's no difference in the complications or anything like that between the ones that are provided by them and the ones that are provided by the MDs. The American Public Health Association and the American College of Obstetricians and Gynecologists recommend that all appropriately trained nurse practitioners, certified nurse midwives, and physician's assistants be allowed to provide abortion services. This is one of 2 pieces of new legislation I'm introducing this year on reproductive justice. Providers tell me that the 2 main barriers for women who are seeking abortion in Nebraska are cost and access to underserved areas. This bill seeks to address the access barrier by allowing more qualified practitioners to provide this care. Women of color and low-income women face significant disparities in terms of their ability to access abortion care, and 40% of Nebraska women live in counties with no abortion provider at all. By enabling other qualified licensed providers to provide abortion care, more medical clinics can offer abortion services in areas where MDs are in short supply. I'll also note that today is a very big day in the legislature. We call it Abortion Day. We have some contraceptive and my bill coming up here in HHS. In Judiciary, they're hearing several bills. And there's also a hearing happening in Government Committee today that would ban schools from teaching historically and scientifically accurate information about race and sex in the history of our country. So in the big picture, there are a lot of hearings today that are garnering a lot of attention. And I want you to know that the lack of, the fact that we don't have an overflow room for this bill doesn't indicate a lack of support for this bill. And the same would go for Senator Moorfeld's bill. I've urged supporters for my bill to go testify in Judiciary today. And I'm happy to handle this bill in here with you guys and take any questions and continue to work this throughout the session. People have been getting pregnant since the beginning of time, and there have been people who don't want to be pregnant who are pregnant since the beginning of time. And there will always be people who need to terminate their pregnancies for whatever reason. When someone has made the decision to terminate a pregnancy, they should be able to do that as soon as they can, as soon as they need to, without any delay. And no matter how we personally feel about abortion, I trust individual Nebraskans and I trust Nebraska healthcare providers to make the right decisions about how to handle pregnancy and fertility. So I'd be happy to answer any questions. Thank you.
Thank you, Chairman Arch. I'm happy to work with anyone on technical aspects of the bill. My goal with
this bill is basically to bring Nebraska up to the current standard of care that we have in the medical field around abortion. This law was originally passed in 1977, saying that it has to be an MD attending the abortion. At that time, as Danielle Conrad mentioned in her testimony, the type of medical care that we had around this procedure was very different. And today, most abortions are medication abortions. You don't need to be an MD to give somebody 2 pills to take. We know that this can be done via telemedicine like they do in Iowa and in over 25 other states. What I'm asking Nebraska to catch up and do is what's done already in 17 other states, including Illinois, Colorado, Montana, many, many states. And there are no adverse complications for the patient. I'll also point out that concerns about safety of the procedure are just really unfounded. I support anybody's right to be anti-abortion. That is fine. I understand the diversity of philosophical views and religious views and experiences that cause people to come to these conclusions. And this is all I want for people. I want for women what men want for themselves, which is to use their own judgment in consultation with their family and their doctor and their faith and their own introspection to do what's right for them. And sometimes we are not able to continue a pregnancy, and it's not necessarily a morally bad reason or a morally good reason, it's just a medical reason. And I trust women and their families to make these deeply personal decisions. So when we're talking about the safety, this is to say nothing about something like abortion reversal, which we passed in 2019, which was LB716, where the legislature put into statute a completely untested, a completely unscientifically valid procedure saying, if a woman gets a medication abortion and she changes her mind, she needs to be shot up with a load of progesterone of varying amounts. Like, there's no medical guidance around this at all, and we put that in statute. And so if you're going to talk about safety, abortion is safe, medication abortion is safe. I trust our medical providers in Nebraska to provide this service safely. What's not safe is untested procedures like abortion reversal, which this body has already approved of. So if you're against abortion, just say that. Say, I don't support your bill, Meg, because I don't like abortion. I get it, that's fine. But don't say it's unsafe, because it's literally not unsafe. That's not the issue. I'm going to save my powder for the floor, but I'm happy to take any other questions about this bill.
Thank you. Are there any questions?
Thank you.
Seeing none, thank you.